we've been reporting that this clotting disorder was found in 6 people, all women between the ages of 18 and 48. And health leaders are considering a lot of factors, including if birth control had any effect on this. How could taking a contraceptive be linked to blood clotting?
Yeah, what happens is that when you take a contraceptive, your chances of developing any blood clot is increased. I mean, the thing about this blood clot, and then hearing some of the fallout from the recommendation, the FDA and CDC, I think it's completely uncalled for. You have a rare and potentially fatal blood clot. This is not just a little blood clot that could occur anywhere. It's a severe type of blood clot. To me, it shows that the FDA and the CDC is dead serious about safety. You really can't have it both ways. People criticize the FDA that they approved this vaccine with very little testing and no concern for safety. Now, when they say, listen, we have a concern and we want to look at it, and there's this fallout, that shows to me this is a medical problem, not a political one. So again, to answer your question, you may be at increased risk because of the fact that you take birth control pills. But the whole idea behind some of the ramifications of this recommendation from the CDC and the FDA, I'm proud that the CDC and the FDA have the guts to say we feel there may be an issue and we want people to be safe and make sure that everything is okay before rolling it out again. To me, that's a great sign.
So basically, the system is working to protect Americans and get the information they need. We've also seen clotting issues in the AstraZeneca vaccine in Europe. What are the similarities between the Johnson & Johnson and AstraZeneca vaccines, and how are they different from the Pfizer-Moderna vaccines?
The way the vaccines are made are completely different. But the AstraZeneca vaccine in Europe, they've actually given this a side effect warning that there's been, I think, 18 deaths, over 25 million cases. So they said, listen, and it's not the same kind of blood clotting disorder we're seeing in the Johnson and Johnson. Again, these all may be just something that's in the background, may not be a causal relationship. But these vaccines, these 2 vaccines, AstraZeneca and Johnson, there are some signs that there could be concern, and we have to investigate it before going forward. But the vaccines are made differently. One's an mRNA vaccine, and the others are not. So I think that's what leads to a little bit of a difference in how the vaccines, are made, and possibly some of the side effects. Again, everything information is coming in, and we have to address them as they come along, and that's the key
Sure.
to it.
Well, now that the Johnson & Johnson vaccine is paused for the moment, vaccine hesitancy is in the spotlight yet again. The latest update from the state shows 75,000 new doses administered. The total number of doses administered in our state now closing in on the 5.5 million mark. What is your message to Metro Detroiters who might be now second guessing the Pfizer vaccine or the Moderna vaccine because of what we've seen with the Johnson & Johnson pause?
Well, we've seen the Pfizer and the Moderna vaccine really have no problems whatsoever, and it's been quite a while, and millions of doses, and we just reported that only 5% of the vaccine, total has been from Johnson and Johnson. So the question about vaccine hesitancy, you have to know that the CDC and the FDA are here to keep you safe. So to me, it reinforces the fact that it is safe, and you've got 2 choices that have been shown again and again to be safe. To me, I wouldn't hesitate at all. I would be more faithful in the system. When people doubted the system, now you can say, listen, if there is a safety concern, we will address it. It's like any other medicine that anybody takes.
Right.
It's that if there is a safety concern, we'll address it. So to me, you should be
Yep.
even more secure in taking the vaccine, and you have 2 choices that have been shown to be safe.
Sure. And we should note, again, the J&J issue, extremely rare, fewer than 1 in a million people when you look at the statistics. Dr. Partha Nandi, thank you for joining us today. We do appreciate it.
My pleasure. Have a good day.